Have you noticed how quickly the rules around Social Security and Medicare seem to be changing lately? One week, it's a new Medicare program. The next week, it's a major update on the future of Social Security. Then suddenly, there are new COLA projections, new SSA procedures, and a surge in scams targeting older Americans. The problem isn't just that these changes are happening, it's that most retirees never hear about them until it's too late to take advantage of an opportunity or avoid a costly mistake. And that's exactly why today's update is so important. Over the next few minutes, I'm going to walk you through 5 major developments that every Social Security and Medicare beneficiary should know right now. Some officially begin this week. Others could directly influence the amount of money you receive in future benefit checks. And one of these changes could save eligible seniors thousands of dollars over the next 2 years if they qualify. Whether you're already retired, planning to retire soon, or helping a parent navigate these programs, today's information could make a real difference. So stay with me until the end because each update builds on the last, and the final warning may be the one that protects your savings the most. Before we begin, take a second to subscribe to the channel and turn on notifications. Every week, we break down complicated government announcements into plain English so you don't have to spend hours reading policy documents or sorting through confusing headlines. The goal here isn't to create panic, it's to help you stay informed before changes affect your wallet. Now, let's begin with what may be one of the biggest Medicare developments we've seen in decades. For the first time in Medicare's history, a completely new pathway is opening that could dramatically reduce the cost of certain weight loss medications for eligible beneficiaries. This marks a significant shift in how Medicare approaches obesity treatment and chronic disease management. Beginning this month, qualified beneficiaries enrolled in Medicare Part D may have access to specific GLP-1 medications through a new federal initiative designed to make these treatments more affordable. For the first time in Medicare's history, a completely new pathway is opening that could dramatically reduce the cost of certain weight loss medications for eligible beneficiaries. This marks a significant shift in how Medicare approaches obesity treatment and chronic disease management. Beginning this month, qualified beneficiaries enrolled in Medicare Part D may have access to specific GLP-1 medications through a new federal initiative designed to make these treatments more affordable. Now, under the new Temporary Bridge program, many eligible beneficiaries could pay a fixed monthly amount instead of facing the full retail cost. For seniors who qualify, this represents one of the most significant prescription cost changes in recent memory. Instead of paying hundreds of dollars every month, eligible participants may pay a much lower flat monthly amount for covered medications, making treatment far more realistic for retirees living on fixed incomes. The program is scheduled to continue through the end of 2027, giving beneficiaries an opportunity to access therapies that were previously beyond reach financially. However, there are important eligibility requirements that many headlines leave out. This isn't automatic coverage for everyone on Medicare. Participants generally must be enrolled in a qualifying Medicare Part D prescription drug plan, and doctors must document that patients meet specific medical criteria before coverage is approved. Those criteria typically involve body mass index thresholds along with certain health conditions that increase medical risk. Your physician will ultimately determine whether you meet the clinical requirements and submit the necessary prior authorization paperwork if appropriate. There are also 2 details that deserve careful attention because they could affect expectations. First, this special program operates separately from the standard Part D benefit structure, meaning it follows its own rules regarding cost sharing. Second, beneficiaries who already receive one of these medications under Medicare for another approved medical condition may not qualify under this particular bridge program since it was designed primarily to expand access for weight management where previous coverage options were limited. That's why it's worth having a conversation with your physician and your Part D plan before assuming you qualify. A simple phone call could clarify whether this opportunity applies to your situation. Now let's shift from Medicare to a topic that continues to dominate conversations among retirees across the country: the future of Social Security. If you've heard alarming headlines recently about benefit reductions, trust fund deadlines, or Congress debating major reforms, you're not imagining it. The discussion has intensified, and while nothing changes for current beneficiaries overnight, the long-term questions are becoming increasingly difficult for lawmakers to ignore. According to the latest annual Social Security Trustees Report, the Retirement Trust Fund continues to face financial pressure under current law. If no legislative changes are made before the projected depletion date, incoming payroll tax revenue alone would cover only a portion of scheduled benefits. That doesn't mean Social Security disappears. It doesn't mean checks suddenly stop arriving. What it does mean is that, under current law, benefits would need to be adjusted unless Congress acts beforehand to strengthen the program's finances. For millions of retirees, this has become one of the biggest financial questions of the decade. Social Security isn't just supplemental income anymore. For many households, it represents the primary source of monthly income covering housing, groceries, utilities, transportation, and prescription medications. That's why every proposal coming out of Washington is receiving so much attention. Some lawmakers support raising or eliminating the payroll tax cap so higher earners contribute more into the system. Others favor gradually adjusting eligibility rules, modifying benefits for higher-income retirees, or exploring long-term investment strategies designed to extend the program's solvency. At this point, none of these proposals has become law. They remain ideas under discussion, and the final outcome could look very different from today's headlines. But the conversation itself is important because whatever Congress eventually decides will affect future retirees, and possibly current beneficiaries as well. Staying informed allows you to separate actual legislative action from speculation and gives you time to prepare rather than react after decisions have already been made. Another important development begins quietly this month, but its impact could eventually appear in your January Social Security payment. July marks the beginning of the 3-month period that helps determine next year's cost of living adjustment, better known as COLA. Every year, inflation data collected during July, August, and September plays a central role in calculating how much Social Security benefits increase the following January. Right now, economists and retirement policy analysts believe next year's adjustment could come in higher than this year's increase if inflation remains elevated through the summer months. Fuel prices, grocery costs, housing expenses, and medical inflation will all influence the final calculation. Of course, these are only projections. The official COLA won't be announced until October after all 3 months of inflation data have been finalized. But what happens over the next several weeks could have a direct impact on every retiree's monthly benefit next year. That's why it's important not to overreact to early estimates. Some headlines will claim a much larger increase is guaranteed. Others will predict disappointment. The truth is that nobody knows the official number yet because the calculation is still underway. What we do know is that the process has begun, and the economic data released throughout the summer will ultimately determine the adjustment retirees receive next January. Another change that deserves your attention has nothing to do with the amount of your benefit check, but everything to do with how quickly you can resolve a problem if one ever arises. Over the past year, the Social Security Administration has continued modernizing its customer service operations, but for many beneficiaries, the experience has become very different from what it was just a few years ago. If you haven't contacted Social Security recently, you may be surprised by how much the process has changed. Many routine requests that were once handled by a familiar local office are now routed through a centralized national system. That means the representative who answers your call could be located hundreds or even thousands of miles away and may not be familiar with the procedures or state-specific programs that affect your individual situation. While these representatives are trained to answer general questions, retirees across the country have reported receiving different answers depending on which representative they spoke with. That doesn't necessarily mean anyone is giving incorrect information, but it does mean that complicated cases sometimes require additional follow-up before you receive a complete answer. Because of these changes, preparation has become more important than ever before you pick up the phone. Instead of calling with a general question, write down exactly what you need to know beforehand. Have your Social Security number available. Keep any recent notices or letters nearby. And if your issue involves Medicare, taxes, direct deposit, or benefit verification, make sure you have the relevant documents in front of you. A well-prepared 5-minute conversation often produces better results than a 30-minute call where you're trying to remember dates or locate paperwork while you're already on hold. Even better, many of the tasks that once required a phone call can now be completed online through your My Social Security account. If you haven't created one yet, now is an excellent time to do it. Not because there's an emergency, but because it's much easier to set up your account before you urgently need it. Through the online portal, beneficiaries can verify payment dates, update direct deposit information, print benefit verification letters, download annual tax forms, review earnings records, and monitor the status of applications without waiting on hold. Think of it as your digital filing cabinet for everything related to your Social Security benefits. Having access before a problem develops can save hours of frustration later. Another issue that deserves serious attention this summer is Medicare enrollment awareness. Every year, thousands of retirees discover they missed an enrollment deadline or delayed reviewing their prescription drug coverage simply because they assumed nothing had changed. But insurance plans change every year. Formularies change. Networks change. Prescription costs change. A medication that was affordable last year may move to a different pricing tier next year, while another drug may become less expensive. That's why financial advisors consistently recommend reviewing your Medicare coverage annually instead of assuming your current plan will always remain the best fit. This doesn't necessarily mean switching plans every year. In many cases, your existing coverage may still be the best option. The point is to compare your current benefits against what's available, rather than automatically renewing without looking. Spending 30 minutes reviewing your options during enrollment season could potentially save hundreds or even thousands of dollars over the course of a year if your healthcare needs have changed. Now let's talk about something that unfortunately continues to grow at an alarming pace: fraud targeting older Americans. Criminals today are far more sophisticated than they were even a few years ago. They no longer rely only on poorly written emails or obvious scam phone calls. Many now use artificial intelligence to clone voices, create convincing documents, spoof government phone numbers, and gather personal information from previous data breaches to make their stories sound believable. Some callers know your doctor's name. Others know the last 4 digits of your Social Security number or your mailing address. That information often comes from unrelated data leaks, not from the Social Security Administration itself. But criminals use it to build trust before attempting to steal money or personal information. One of the biggest mistakes people make is assuming that because a caller knows personal details, the call must be legitimate. Unfortunately, that's no longer true. Modern scammers often begin conversations by proving they know something about you. Once they've earned your confidence, they create urgency. They'll claim your benefits are about to be suspended, your Medicare card needs immediate verification, or your bank account is at risk unless you act within minutes. The pressure is intentional because people make poor decisions when they feel rushed. Here's the rule that can protect you almost every single time. Legitimate government agencies do not demand immediate payment over the phone. They do not ask for gift cards, cryptocurrency, prepaid debit cards, or wire transfers. They do not threaten to suspend your Social Security number if you refuse to cooperate. They do not tell you to keep the conversation secret from your family. And they certainly do not ask you to transfer your savings into a safe account while they investigate fraud. The moment any caller introduces those tactics, the conversation is over. Hang up immediately. If you ever feel uncertain about a call, don't try to solve the problem while the caller remains on the line. End the conversation first. Then, locate the official phone number directly from the Social Security Administration's website, Medicare, or the back of your Medicare card and make the call yourself. That simple step removes almost every opportunity for scammers to manipulate you. One final reminder before we wrap up today's update. Don't let headlines alone determine your financial decisions. Every week, you'll see dramatic stories predicting the end of Social Security, massive Medicare changes, enormous COLA increases, or sweeping benefit cuts. Some headlines contain a small amount of truth mixed with a lot of speculation. Others leave out the timelines entirely. Remember that many policy discussions take months or even years to become law. Understanding what's actually changing today versus what's simply being debated for the future is one of the most valuable financial skills any retiree can develop. So let's quickly recap the biggest developments. Medicare is expanding access to certain weight management medications for eligible beneficiaries under a new bridge program, offering significant savings for those who qualify. Social Security's long-term financial outlook continues to dominate discussions in Washington, but no benefit changes have taken effect today. The official measurement period for next year's COLA has begun, meaning the inflation data released over the next several months will help determine your increase for next January. The Social Security Administration continues operating under its newer national customer service model, making online account access more valuable than ever. And finally, fraud targeting retirees continues to evolve, making awareness your strongest defense against financial loss. If you found today's update helpful, make sure you're subscribed and turn on notifications so you don't miss future Social Security and Medicare updates. Share this video with a friend, family member, or neighbor who depends on these benefits, because one piece of timely information could help someone avoid a costly mistake or discover a benefit they didn't know existed. Thank you for watching, stay informed, stay safe, and I'll see you in the next video.